Hello and welcome to the second collaborative education module between the North Carolina Healthcare Association and the Advisory Board Company. My name is Connor O'Brien. With you again, I am a faculty member at the head office of the Advisory Board in Washington, D.C. This module, the second of three, is called Advocacy and the Healthcare Ecosystem, and it builds on topics we discussed in the first module, which we called Healthcare 101. Let's dive into to our discussion of the healthcare ecosystem. We'll begin the first of three parts of this discussion across the next 15 minutes or so, is about the notion of resilience. Let me take you back to, I don't know, might have been high school or middle school when you first discussed the environment in class, or maybe it was in biology or earth science. But the notion of an ecosystem. The important thing to recall about ecosystems is that no organism or group of organisms in any environment exists as an island within that environment. Rather, those organisms are affected by, are impacted by the other organisms and indeed other components of the ecosystem around them, including the ones that are not living, like the terrain, like the climate and the way it changes, like increases or decreases in food resources and so on. Indeed, not only are organisms acted upon by the other ecosystem components around them, they in turn act upon those other components. And therefore, it just does no good to consider any one of them in isolation. With that as sort of a jumping off point, we want to review that, in fact, because a group of organisms affects the ecosystem, highly adaptive organisms can actually shape some of those forces, ecosystem forces, and adapt to them. Let me give you a case in point. Anthropological studies of two indigenous tribes down in Australia. One we will call a desert tribe, the other a river tribe, and that is because those two words are great summaries of the environments within which those two tribes lived. I'm going to tell you first about the river tribe. This group lived in an environment, an ecosystem that from a remove we probably thought was quite advantageous. It had a lot of precipitation, a lot of lush vegetation, and yet, despite some of the advantages of that ecosystem, this tribe, both in their oral history and in evidence we could gain from archaeological digs, showed a lot of evidence of rises and falls in population. Great population growth, and then devastating response to intermittent famine. And the reason this happened, despite some of the advantages of the ecosystem, was because this tribe, the river tribe, demonstrated what we call low control and low adaptability. Now, here's what we mean by each of those. Control is the ability to shape the ecosystem forces around you. All right, it's a sort of an external view. And if this is the way that the ecosystem works, what can we do to take advantage of certain of those things? Now, in the case of the river tribe, we're saying they had low control. They did not shape forces. And a straightforward example of that is when times were good and the rains were falling, they would not stockpile food in anticipation of the next drought, even though within generations, there was a history of drought. It's not that they didn't know it was coming. It's not that they didn't remember. They just would not shape that external force. And as a result, when the drought came, there was great loss of life. Now, the river tribe also demonstrated low adaptability, where control is sort of an outward look to the ecosystem forces. Adaptability is an inward look toward the way we organize in response to the ecosystem. Now, what do we mean by this? Here's an example from the river tribe. They were agrarian, which is to say they would sit at the same plot of land and cultivate it. Their entire social structure was built up around this, social hierarchies, traditions, rituals, and so on. And as a result, tethered to one piece of land, they would not move around to follow the rains. And in times of drought and without stockpiling, they could not or would not change their social structures, their customs, their approaches to work to take advantage. Low control, not shaping external forces. Low adaptability, not altering our internal organization to thrive. Now let's contrast that quickly with the desert tribe, who, despite living in what we would regard as a much more challenging environment, showed no evidence of feast or famine population spikes and troughs, but indeed thrived despite or perhaps because of the challenges of the ecosystem. More on that in a second. Let's look at control and adaptability here with the desert tribe. The desert tribe demonstrated high control. In this case, planting, harvesting, and stockpiling as the climate allowed, in a way quite different from the river tribe. They also demonstrated high adaptability. They were pastoralists, which is to say they lived in very, very small and easy to move dwellings. They moved around, they followed the rains, and so on. Their social structures were quite different because of the mobile nature of that tribe. Despite the challenges of the desert environment, it is the desert tribe, through high control and high adaptability, that became the most resilient across time. And that's an important topic for us, resilience. Consider, if all we do is react to changes in the ecosystem around us, we may be able to survive. We may, but we very likely will not thrive. On the other hand, consider the desert tribe, which seems to be stronger and more able to thrive because of their response to the stresses of the ecosystem. Good metaphor here might be to consider muscle tissue. When muscle tissue is exercised at the cellular level, it's damaged, isn't it? There's it tears. It is injured, if you will. Yet the muscle comes back, able to flex with more power, able to relax with more flexibility. The muscle has become stronger because of the stress that it has lived through. So too with the desert tribe. They are able to thrive because of the control and adaptability that they summon because of the stresses of their environment. And this is a potent metaphor, resilience, for any business, and that includes a healthcare business. Imagine being stronger because of the stresses that we endure, not merely reacting to them and trying to survive, but indeed thriving, being more resilient because of those challenges. Here's a graph of the day-to-day existence of the river tribe, or any group or organization that merely reacts to ecosystem forces. When times are good, instead of asserting a control and adapting for the future, this group dwells down there at the bottom there in a stasis zone, maintaining current course and speed such that when there is a change, the existence spikes up into a crisis zone. Reacting in some cases, and indeed from our tribal stories, in the worst way possible, with in that case loss of life, and an inability, it would seem, to learn lessons from what had just happened. Now, by contrast, here is the graph of existence in the desert tribe. Now, first, let's be clear: it's not all sweetness and light, right? There are shocks being asserted from outside the tribe by the ecosystem. But indeed, the desert tribe, because of its ability to assert control and demonstrate adaptability, they deal with those changes, those shocks, in a way that is neither crisis, with, in the worst case, loss of life, nor stasis at the bottom. And this is critically important. When times are good, there are still adaptations to be made. Is still control to assert in the ecosystem around us. This is the tribe, of course, that you wanted to be living in. because the challenges of day to day did not rise to crisis, and there was always endeavor toward improving the way that we lived in that ecosystem. And so we're down to it. If we're talking about the ecosystem within which we as healthcare providers operate, there are four forces. Here they are over on the left: demographics, the economy, technology, and public policy. And of those four, we're going to focus for the next few minutes on the public policy ecosystem force, with a view to summoning both control and adaptability in pursuit of resilience, not merely reacting to changes in the force of public policy, but shaping that force and adapting internally in response to and anticipation of what is coming. So let's turn our attention to the force of public policy. In this map of the United States, we've called out a number of places where public policy is being wielded, shaped, where changes are being imposed on our business because of the ecosystem force of public policy. And our point here is to show that it really is an ecosystem force and not just a small thing in our existence. Over on the right-hand side, there's a lot of attention paid in Washington, D.C., which of course is the nation's capital, but boy, oh boy, is there a lot going on at state and local levels, including in the middle there, the North Carolina General Assembly, which we have called out here in Raleigh. At the bottom, in not just the obvious ways, laws and policies, but in less obvious forms like rules and even funding priorities of government bodies, public policy is all around us, and it does directly affect how we deliver what we deliver. But if we take a more analytical look at it, we see that the public policy process actually has 5 steps. Here they are briefly. Let's focus on each step in the phase column on the left. First is recognition. This is where agendas are set. Discussions within the populace, between and amongst decision makers and frontline folks on the ground. This is where problems and issues are first surfaced as matters of concern, which then proceeds to the second phase, political. This is where not only parties, but other groups and bodies begin to stake out positions on issues and vie for the attention of decision makers to make sure that their views are reflected in the next phase, which is enactment. And this is the one you're probably most familiar with. This is how a bill becomes a law from Schoolhouse Rock a few years ago. There is a process around that, but the point we want to make here is that for all the attention it gets, it is only one of 5 phases. It's the one in the middle. It is followed by a regulatory or rulemaking phase. In the case of healthcare policy, for example, a law passed by Congress will then be ported over to the Secretary of Health and Human Services to promulgate that law into rules that can be implemented on the ground, which is our last phase of 5, implementation. Implementation is not just putting in place the machinery to realize what was passed in the law, but it's also how that machinery is deployed to enforce. So implementation includes the building and the enforcement of what was promulgated in the regulatory phase. Here's what we want you to recognize. Here's what we urge you to recognize, that the policy process can be more readily understood by breaking it down into 5 easy to digest chunks, and that in every one of those chunks or phases, from recognition all the way through to implementation, you have an opportunity to shape the ecosystem force. Let me give you an example, and it's right from recent North Carolina history. In the recognition phase of this story, up here on the upper left, communities were recognizing that opioid overdose and death were becoming a critical problem. And they began talking with local lawmakers and state lawmakers to essentially say, something needs to be done about this. Let's start comparing ideas on what might be done. In the political phase, political parties and indeed interest groups, including clinical groups, including first responder groups like police and fire departments, schools, and so on, all began to research, discuss, and stake out positions on how a law might be made to address this problem of opioid overdose and death. A law was passed in North Carolina providing for a standing prescription order such that initially any first responder would be provisioned for doses of Narcan to administer to an addict experiencing an overdose. Rules were put in place about how that was going to be provided for, the mechanism around which the doses of the drug would be sent to police stations, firehouses, how that would be funded, and so on. And then it was implemented, and with changes and adaptations made along the way. North Carolina is one of 21 states that now have standing orders to provide naloxone to overdosing addicts. Now, there's an important point here, and that there's a feedback loop between implementation and recognition, and that's going on right now in the very, very same issue terrain. So, for example, now through the public policy process, North Carolina has addressed the urgent issue of huge numbers of overdoses and deaths. A new set of issues related is emerging, and that is what happens when we release an addict or discharge an addict after getting that dose of drug. If they go back to the same neighborhood where they were originally, they might just overdose again. And so how many times are we going to provide for this? What sort of social services should be available to make sure that that addict just doesn't immediately relapse? We are in the recognition phase of that related issue set. And so it goes. The process is ongoing. The process is iterative. And it is one more indication that it's an ecosystem force, because there is constant discussion and action about things that we provide to the community and that we are best able issues that we are best able to help sort out and address. Now, I realize I said a few minutes ago that there's a role for you to shape the ecosystem force in each of those 5 phases. And I want to reinforce that right now. Congress and the executive branch get a lot of attention on cable news and national news wires and so on, what's going on in Washington. Well, that is important. And indeed, working with your government affairs director, your chief lobbyists, and so on, you can help shape that force at the national level. But what I'd like to point out to you on this graphic is that at the state and local level, your leverage is even greater. And that is because of the influence that providers and provider systems wield at the state and local level. You are among the biggest employers in your neck of the woods. You provide a critical service to communities around you. And indeed, there is a level of complexity and expertise required to sort through all these issues that oftentimes are just not present within legislative staffs, regulatory offices, and so on. The point is, yours is a voice that the participants in this process want to hear. And we want you to take full advantage of that opportunity. In fact, we've got the third part of our discussion here, some examples from the field. These are healthcare providers who, like the Desert Tribe, asserted a bit of control, shaping the forces around them and adapting to not just respond to those ecosystem forces, but to anticipate and to get out front of them. Our first of 3 quick examples here is from Texas. These previously unaffiliated hospitals from El Paso and Westlake, the San Angelo hospitals, and up in Dallas, came together to raise awareness against proposed state budget cuts. So this is in the recognition phase before we're even talking about law or rule. What they did was make sure through a lot of public forums that people recognized here is what's going to happen to local healthcare if these state budget cuts are enacted. Things like on the upper left, news conferences formally, rallies on courthouse steps throughout the state. On the upper right, critically important, writing op-ed pieces, writing letters to the editor in the big statewide and local, and also local newspapers, and also critically, given the age in which we live, social media leveraging to make sure that the message is getting out and that we are activating people to get involved in this discussion. All right. There's a story from Texas having to do with the recognition phase. Let's talk about the legislative or the enactment phase here. A story from Colorado, particularly Children's Hospital in Colorado. Here was a proposed legislation that cut the state soda tax, the soft drink tax. All right. Not only was it going to, reduce the tax receipts of the state, but the good folks at Children's recognized, what, this could have a bad impact on pediatric obesity and so on. And so some volunteers from Children's activated a network that leveraged existing relationships that professionals at Children's had with legislators and regulators in Denver and across the state. An informal network that applied very, very direct pressure because of personal relationships. And as a result, that budget measure, particularly regarding the soft drink tax, was defeated in the enactment phase in the Colorado General Assembly. We got one more example here, and this is from the regulatory, the rulemaking phase after law is passed. This group of hospitals is not from one jurisdiction and not from one state, but a group of rural hospitals across the country recognized a threat in the 340B legislation, or a part of the ACA legislation. As it turns out, rural hospitals often have a higher proportion of their prescription drugs being prescribed for off-label purposes. The law provided for much higher prices. If you're going to write the script for an off-label application, you're going to have to pay a higher price for that drug. The rural hospitals suggested that is going to be financially crippling for us. And as a result, because they provided public comments during the rulemaking phase after the law was passed, they got an exemption, essentially a carve-out to be spared those price increases. So 5 phases, we gave you 3 examples, one from each of 3 different phases within the 5. The point is the opportunity is there. The opportunity is great. And in each of these instances, in one case, it was a hospital in Colorado. In the other 2 cases, it was groups of hospitals with no prior affiliation acting like the desert tribe and striking resilience in an ecosystem that otherwise could be quite harsh. All right. So here's where I'd like to pull up for a moment and consider where we've been. When thinking about what to do next, the first is to recognize that just like a desert tribe or a river tribe, providers and provider networks are not islands. They exist in an ecosystem and are subject to, and indeed have an impact on, forces around them. Please consider the following questions. They're a bit challenging, but they're essential to taking full advantage of the opportunities I've begun describing here and in considering what to do next. Number 1, what impact has public policy had on the delivery of healthcare in my neck of the woods? Sure, think about the national level, think about the statewide level, but think also perhaps closer to home. How has policy affected what you deliver and how you deliver it? And consider too this second question, which is a challenging one. Instead of merely reacting to changes in policy, how can I and my colleagues pursue resilience, becoming stronger because of the pressure exerted by the force of public policy? What can I and my colleagues begin to do? I've given you 3 examples from 3 of the 5 phases of the public policy process. And I hope that activates some reflection and thought on your part. I want to thank you for stepping through this with me over the last few minutes, and I look forward to seeing you again in our 3rd and final module called Preparing Your Advocacy Story. Thank you very much for joining.